Hi, my name is Liselina Foso, and I work at St George's Hospital as a health improvement specialist for the Bowel Cancer Screening Centre. I want to talk to you today around the importance of doing your bowel cancer screening test, and I also want to talk around bowel cancer and the general signs and symptoms. As you may or may not know, bowel cancer is actually the fourth most common cancer in the UK, and it's also the second biggest cause of cancer deaths. That's why, particularly in April, as it's Bowel Cancer Awareness Month, we do our best to make sure we raise awareness around the importance of doing your screen and also generally knowing your bodies and looking out for signs and symptoms. So here you have the bowel cancer screening test. If you're aged between 56 and 74, you'll receive this kit in the post every 2 years. It comes in a prepaid envelope, so I just want to talk you through how simple it is to do the test. So if you open it up, you've got the test inside. The test will come with a fit kit. It's called a fecal immunochemical test, and this is the test that you use to collect your stool sample. So all you need to do is do a poo and make sure that it doesn't touch the toilet water. So you can either collect it directly in your hand using a glove or using tissue or even a clean container. But the main thing is it doesn't touch the water. Once you collect your stool sample, open up the fit kit and you simply scrape it along the stool sample and then you place it back inside. Once it's done, you make sure you complete the sample date and you simply pop it back inside the prepaid envelope and you send it off to be processed by the lab. Finally, we're going to touch on the bowel cancer signs and symptoms. So firstly, you have a persistent change in bowel habit. So that could be either going to the toilet too much or not going enough. So that's either diarrhea or constipation. There's also blood in your stool. So whenever you go to the toilet, it's really important that once you've done a poo, you check inside to see if there's any blood in the toilet. Or also when you wipe your bottom, check in to see if there's any blood on the tissue. Then there is also a lump and a pain in your tummy. So if you get either of those, that could be a bowel cancer sign and symptom. There's also feeling bloated inside your tummy. And finally, there's also unexplained weight loss. Just to bear in mind, these symptoms could also be anything else, but where we know that there's signs and symptoms of bowel cancer, it's really important that when you do get them, or if you do get them, that you seek help with a health professional.